Hypoglycemia or low blood sugar level is one of the commonly found conditions in people with diabetes. Hypoglycemia can be defined as blood sugar level below 70 mg per dl. It can occur in any person with diabetes who is on insulin or blood sugar lowering medications. Let's look at some common causes of hypoglycemia. Excess insulin dose or medication is one of the most common causes for hypoglycemia. Not eating enough or not eating at proper time, skipping or delaying meals, not eating enough after consuming alcohol are some other reasons. Unplanned or excessive exercise may also lead to hypoglycemia. Now, what are the symptoms of hypoglycemia? According to the type of hypoglycemia, the symptoms can change. Mild hypoglycemia gives symptoms like headache, shaking, pounding heartbeats, sweating, tiredness, dizziness, blurred vision, drowsiness, or tingling sensation around mouth or lips. Mild hypoglycemia can be managed easily. Moderate hypoglycemia gives symptoms like personality change, irritability, confusion, poor coordination, difficulty in concentrating, or slurred speech. This type of hypoglycemia can be managed, but it requires immediate attention. The third type, severe hypoglycemia, leads to coma or seizures. Severe hypoglycemia requires emergency treatment. The patient needs to be hospitalized for the management of severe hypoglycemia. Now, how to detect hypoglycemia? It is very simple. Based on symptoms and by checking your blood sugar level immediately after symptoms will give you an idea whether you are suffering from hypoglycemia. The other indication of hypoglycemia is when blood sugar level is increased, the symptoms disappear. How to treat hypoglycemia? Remember, early recognition and appropriate treatment is the key to manage and treat hypoglycemia. The rule of 15 is a very helpful way to remember the treatment. Rule of 15 says you have to eat 15 grams of fast-acting carbohydrates after the episode of hypoglycemia. 15 grams of carbohydrates may include 15 grams of glucose powder or powdered sugar, 1 tablespoon of honey or jam, half a glass of fruit juice or soft drink. You can have one of the above options immediately after the episode of hypoglycemia. Then you have to wait for 15 minutes and recheck your blood sugar level. If the blood sugar level is above 70, you are supposed to have a light snack to prevent further episodes of hypoglycemia. If blood sugar level is below 70, then you have to repeat 15 grams of carbs and wait for another 15 minutes. You have to recheck your blood sugar to ensure whether your blood sugar level is above 70. The treatment of hypoglycemia should always be followed by some investigation as to why the hypoglycemia occurred and what could be done to prevent its further occurrence. Thank you.